Welcome to today's episode of CoramBAAF Conversations. We're going to be talking about the development and purpose of the Initial Health Assessment Delivery Standards, published by the Royal College of Paediatrics and Child Health. To start us off, I'm going to introduce myself. So I'm Ellie Johnson, and I'm the health consultant at CoramBAAF. And here with me today, I have Vicki and Lynn. Would you like to introduce yourselves and tell me a little bit about your roles in the development of these standards? And I'll go to Vicki first.
Hi, thank you. Yes, my name's Vicki Walker. I'm a paediatric consultant based up in Nottinghamshire. And one of my other roles is the Assistant Officer for Child Protection at the Royal College of Paediatrics and Child Health. And I've designated Doctor for Children in Care. So with both of those sort of hats on, I've always had an interest in trying to support standards and quality for our initial health assessments. And we've been talking about it for some time at the Royal College of Paediatrics. And so we finally got ourselves together with Lynn when she came in on the committee as well. Clearly we needed experts in the field, so CoramBAAF was involved.
Lynn, can I ask you to introduce yourself?
Yeah, thanks, Ellie. So I'm Lynn Snow. I'm a children's doctor who does initial health assessments as part of my clinical role. I'm also the designated doctor for looked after children in Leicester, Leicestershire and Rutland. But the reason I'm involved in this specifically is because about a year ago, I took on the role of the Royal College of Paediatrics and Child Health looked after children's representative and was asked to be part of this work. But it is something that I'm absolutely passionate about and something I've spent many years kind of trying to drive forward locally. So it's great to have the opportunity to do it more nationally.
It seems quite a long time ago since we started out on this process. Lynn, can you go back to the beginning and walk us through how the standards were developed?
The standards were drafted with a multi-agency group of professionals and shaped by the perspective of children and young people, which I think is a really important thing to highlight. So we didn't speak to young people directly, but we looked at research where young people's voice around their health assessments and their experience of healthcare had already been gathered. And that formed a real basis to our application of the work that we undertook. So the first part of the work that was then undertaken was around writing the outcomes, and that was done through workshops. As I said, multi-professional, so we had medics who undertake the initial health assessments, nurses, social workers, independent reviewing officers, general GPs, and independent reviewing officers as well. So quite and people who have undertaken research in this field. So quite a big range of folk. And the outcomes were written from a child first perspective. So using child first language, first person language. And that was done very purposefully to try and ensure that we are constantly centering ourselves on the fact that these are for our young people and our children, and it is their voice that we should be thinking about at all times. And then after the steering group had written the outcomes, we had writing groups who then got together and wrote the standards. There were about 40 people who got together in lots of separate groups and took on a couple of outcomes each, so that they were then writing the standards under that as well. And hugely grateful to all the folk that gave up a lot of time to do that. And that was done very much using initially a free conversation on the topic of the outcome and then drafting specific wording at a second meeting. So that the whole process was really thorough and very structured. And I want to give out a shout out really here to Grace Hasty, who was our Royal College of Paediatrics and Child Health Support. She's the policy manager for safeguarding and ethics at the Royal College and has supported this whole process from start to finish, keeping us on track, which has been really, really important.
Yes, I think I remember thinking that we had a lot of people helping us thinking about what we were aiming to achieve with initial health assessments and thinking about how clinicians, teams, providers and commissioners can meet those goals. And certainly that group of people really helped us get to where we are today. Vicki, Why do you think these standards are so important in today's practice?
Well, standards, it's an interesting term. We use it quite a lot across healthcare and in social care as well. And so I thought it would be useful to try and think about some definitions around this as well, which help us understand things. So when you think about the definition of a standard, it's actually an agreed practice that specifies what should be done and how it should be done, and then a measurable outcome that denotes acceptable performance, which is sort of sounds like quite a strict way of saying it. And within the NHS and healthcare, there are lots and lots of examples of standards and outcomes. And sometimes when we talk about those measurable outcomes, we talk about 90% of the time we will meet that standard, or we'll meet 90% of the standard. So we give ourselves a range of achievement when we're talking about different things. But the standard itself is the absolute measure of quality that we want it to be. And whenever we have outliers to that standard, that's the kind of thing we'd have to look at, and look at processing gaps and what went wrong. In healthcare, and certainly it's probably not called the same thing, but as well in social care, there can be never events, and that's when your standards, it should never ever happen. And as a standard, that's the sort of extreme. Our standards are much more quality driven. And the other thing that we look to from standards, again, thinking about a definition, is standardizing. So clearly they've got the same wording behind it, but when you actually talk about standardizing something, it's the process of converting those sort of variable practices, the variations that we see, into consistent, repeatable actions by applying the same documented set of rules, using the same tools or the same training, the same measurement across all of the people and all of the settings. So you bring our standards in a way to set a quality threshold, and then you can also standardize practice by looking at how that's delivered. And then, of course, you have the so what question. We have standards, and should we use them? And I think when we look at the key benefits, we're probably thinking about things like putting evidence into action. And clearly, when you look this up and you research it, you get these little nice snippets of words that we want to use. But the evidence we're using and talking about really came from research, but it also came from expert consensus. And that's quite a nice term that I uncovered that I think describes really well how we made the standards. What was it that made our groups the people that could say what was the best thing to do? So evidence into action, and the action becomes this concrete steps that clinicians can follow. And the other key phrase that we have around standards is something to set expectations. So we can talk then about the competencies you need, the performance thresholds. And I throw out these management terms because the IHA standards, as we've used them, we have gone all the way from what we'd like clinicians to do, all the way to what we'd like the system to be doing and delivering. And you have to talk about performance thresholds and competencies within that. And then the last one is thinking about measurable targets. So standards and standardizing allow you to create measurable targets. And for us, we probably look at that from audit or from comparison to others, the peer review, the benchmarking. And once you have targets, you can measure yourself. And the key to that really is about then improving. So overall, we've got these clear, repeatable steps that give you decision points, that might give you common tools for us thinking about paperwork and the CoramBAAF work around that. But it also can direct education, assessment, allows you to measure, allows you to feed things back so you can coordinate across settings. That should reduce variations for children and young people. And then I think as we talk further, we'll see what the overall benefits to the system and young people are when we look at it.
Thank you so much, Vicki. I think it'd be really great now if we could perhaps give people a little bit of a flavour of the actual more of the detail of the outcomes and the standards that have been developed. We thought it'd be quite nice to share our favourite outcomes and standards. And Lynn, have you had a chance to think about this? What is one of your favourites?
So we had to definitely take a bit of a step back. I was so sort of immersed in these standards. The question of my favourite needed a bit of thinking about, but actually I've come down on outcome 3. So I will read what it says in the document. So outcome 3, I understand my health needs, my history, and how to access more support. This is communicated to me in a way I understand. And then the standards within the outcome talk about the plan and how that is written. It talks about accessible language and about conveying information to others, including the young person, but also to other secondary healthcare professionals, all to ensure that the children's and young people's healthcare needs are met. And anyone who has heard me talk before on subjects or who's worked with me knows that the whole idea of the health plan and the initial health assessment leading to the health plan, which feeds into the care plan, and the idea of that being holistic, being absolutely centred on the young person's needs, but bringing together, and I always say that, this is absolutely the unique role of the clinicians doing the IHAs, is having the long view, both backwards into the child's history, looking at how the child is now, and then thinking about how all of that, the analysis of those needs, how that then moves on into their future planning and what we can be doing about it now in order to make an impact on their long-term future. So yes, I really like 3 because it's pushing folk to be really thinking quite hard about the language we're using and also that analysis about need and being trauma informed in the centre of it all. So that's why number 3 is my favourite. But I'm sure others have other thoughts about their own favourites. So Vicki, over to you.
Well, I had looked through these. I mean, it's obviously, like children, we shouldn't have favourites, but I think some of them strike a chord in what we're passionate about. And I would say all of the standards are important. I chose outcome 1. And it wasn't because that was the easiest, as it was first. Outcome 1 itself, so I'll read it. I feel positive about interacting with the healthcare system and am empowered to do so. I am listened to, respected, and provided with opportunities to share what matters to me. And you wonder how on earth we suggest you do that. Well, we look at our standards with information. So having information before you come to the appointment, and then supporting attendance also from the adults who are best placed to advocate for those children or who know those young people. And then communication and adapting the communication to meet the needs of those children and young people. So those 3 standards suggest how we might meet that outcome. And when I look at this, I might be putting too much emphasis on this, but I really like the idea of the longer term impact of what we do. We can be a small part of the process. And if we can give a positive view of health, if we can empower young people to think about taking control of their own health, giving them control and confidence to make appointments, to say what they want to say, to ask the questions that they need to ask, that's just amazing. That sets them up for a life of positivity, hopefully, within health. And the idea of then, how do you talk about reducing the adverse childhood experiences? How do you manage those ACEs in the adult world? Well, some of that is empowering people to manage the healthcare systems and to learn how to work within them. And so having the right people in the room, having the right communication, these are basics that we should be doing all the time. And I like to think in paediatrics, we do it all the time. We think, we adapt, we make sure people have got needs, but nobody is perfect and no system is perfect. So enshrining it in a standard just really hammers home how important the basics are. I do a lot of safeguarding teaching as well. And one of my key messages is always around every contact making a difference. And we know when children disclose or tell people about abuse that's happened to them, they don't necessarily do it in the consultation that was a really good consultation that empowered them to know about their health. they do it next time or the time after or the 5th time or the 6th time. So absolutely every contact counts, every person counts, and every person can make a difference. So if we talk about them being positive about that and empowering them to use the system, I think we gain a lot along the way that are almost unintended benefits. But it strikes a chord with me. So yeah, I chose that one as my favourite. Ellie, your turn.
And that actually, Vicky, that really struck a chord with me, what you were just saying about young people maybe speaking to you 10 years after the first time they've met you. And I remember that happening to me when I was a nurse for children in care, that actually 10 review health assessments after first meeting a young person, she was able to open up and talk about some very personal and sensitive things, which were really important to her. But I think for me, I'm a bit of an action person. And so the outcome that really sings to me is, and I'll read it now, is outcome 4, which says, concerns about my health are acted upon in a timely way so that I can feel well and do the things that matter to me. And so I think this is all about getting children and young people the healthcare that they need. And these standards in outcome 4 clearly link to very important things. That is that good health enables you to live your life and do the things you want to do. And for me, this is a real crux and a key reason for doing initial health assessments. The standards here very clearly articulate the need to involve children and young people in these discussions. And in fact, the standards suggest that children and young people should lead some parts of their initial health assessments. And that's quite tricky. And I've been doing a lot of thinking about health assessments because at CoramBAAF, we've been developing a new set of forms that can be used when you're doing initial health assessments. And I've really had to think about, with lots of other people, and really enable children to lead their health assessment. And so we've looked at lots of things like using pictorial prompts and things in our forms. So this outcome and the standards here really link to our CoramBAAF health forms. But with this outcome, I think we have to be realistic, and there are some really big challenges because this outcome is talking about young children, young people having their health needs met in a timely way. We're working at the moment in a situation where we know there are real considerable waits for children and young people for all sorts of healthcare, whether that be mental health, neurodevelopmental assessments, therapies such as speech and language therapy. We know it's really challenging. And so this section of the document is thinking about what can clinicians do to deliver IHAs and mitigate these waiting issues. So in this part of the document, we talk about addressing referral routes and clinical pathways, which are so important. I think that has led us on to think a little bit about challenge, but I'm going to switch back to think about actually what were the challenges we faced when developing this set of standards. Every development process has its hurdles. So I'm going to ask you, Lynn, to think back and talk us through perhaps what some of the challenges have been along the way.
The first thing that popped into my head thinking about this really was around people's availability. Let's be very practical. There are challenges of the process, but that was one of them very definitely, was around, we're busy clinicians, we're busy professionals. So making diary time to actually talk about it, getting 40 people or 10 people in a room together at the same time is tricky. So that was certainly one of them, but which is why, as I said earlier, there was a little bit of slippage at times to allow for that. But we worked around it, and we all kept focused and committed, which was really, really important. I think trying to address the multi-agency element, not within the process, but within the writing of the standards, because I think initial health assessments obviously happen within health, but they only happen within health because they are part of a wider system which crosses boundaries with social care, with education, with health, and lots of different health providers as well. And so there was always having to have in mind that we were writing this as a Royal College Paediatrics child health document, but also needing to speak into the wider system that was around the initial health assessment. So that finding that balance, I think, was quite difficult at times, and we hope that we've managed to do that and draw in how important other people's roles are to enable the medics at the centre to do a good job, and ultimately for the children to have the right outcomes. And then just being really, really practical again, wording. I've never had to worry over words so much. Obviously, I'm perhaps worrying now over how I'm putting things across, but having read other standards and having read other sort of government documents and things, realising that every word you choose is important. Do you use should or do you use could, for example? The word we use will be interpreted, and it's quite important that we get it right. So I'm desperately hoping we have got it right, but we've had lots of people look over it and comment.
So Vicki, do you have anything to add in terms of thinking about challenges? Are there any sort of current challenges that we're facing at the moment?
Well, gosh, there's always challenges, aren't there? And I think language matters. That's always a challenge for us, isn't it? Even making this across 4 nations and the different languages and legislation that we use across the nations. And I think as well, looking at the wider political, social, health system around finances and what's available and what we need to do and what the long-term plan is and what the 10-year plan is and all of these different things. Lots of people are very interested in trying to make life better for children in care, but that can sometimes make it harder if you think there might be something coming out, or when there's changes within the health system, within its leadership, changes to borders, to ICBs, to how things are being done. So in the middle of that quite maelstrom at the moment, we're throwing in a document that says, well, these are really high standards we want you to achieve. So I think anticipating some of the difficulty and the pushback that people are, how can we achieve this in the current climate of where we are? That is the same across the board, but with, for children in care, it's full of very, very passionate people who really, really want to get this right. But any standards doesn't absolutely expect you to meet each standard to its fullest capacity immediately. As I'd said before when we were talking about why we use standards, if we give people something to aim for, we give people something they can use to talk about service improvements or system delivery, that actually empowers the professionals who are trying to deliver this. So even though at first thought one might think, I can't do this, actually, when you think a little deeper from what makes change and moves things forward, this is actually quite helpful. I hope it will be anyway, quite helpful. And there is absolutely nothing wrong in being aspirational. And we should all continue to be aspirational in what we want. I think there are some real practical parts of this. We very much have tried to put some indicators within the standards as well. So they may feel straightforward, but just reminding people that the measurable outcome, the indicator, might be an audit, might be the feedback, it might be this, it might be that. So again, just supporting people with something that says this will help you. This will help you personally deliver a service, but this will help you talk about delivering a better service. And the challenge is just getting that right. The challenge is being practical and asking just enough, but not too much, and helping afterwards. So the next steps around standards and what we do next are always important. And what can the RCPCH do? What can CoramBAAF do to then support the workforce and move it forward? So it's always an ongoing process, isn't it, around sort of quality and improvement.
Yeah, and I think from us at CoramBAAF, we've really found that the opportunity to work with the Royal College of Paediatrics and Child Health, and particularly with the clinical leads on the project, has been really helpful as we have developed our child health assessment forms, and we have been able to look at the outcomes and standards as they've been developed and think about how can we do things in our new forms that are going to help practitioners achieve the standards. And we very much all the way through tried to align the new forms and the standards as they've been developing. They haven't quite both been published exactly the same time, but nearly. So we hope that will be really helpful for teams and practitioners to be able to look at both the standards and the CoramBAAF forms at the same time. Lynn, I wonder if I could ask you to finish our discussion today and think just a little bit into the future and what you would like to see, how you'd like to see the standards used in practice.
Well, I'm hoping first and foremost that people do use them, and that they, as Vicki's been saying, really do use them as a tool, as a way to drive up personal practice, the way to have difficult conversations with providers and commissioners, and use those standards to make a difference locally for their work, for their organisation, and ultimately for young people. One of the things that we're starting to think around would be whether there is an audit tool that might go alongside these standards. Not that I'm trying to give us any more work, having just completed quite a large piece of work, but people could be developing their own benchmarking locally from the standards. They could even be doing that regionally, able to start, benchmarking against other services. And then, yes, ultimately to have a kind of national tool that we could use would be great. And ultimately, what I would love to see long term is that this improves outcomes for our children and young people. This is not just a dry document about how I write something on form, although the forms help me to do that and to do it well, but it is ultimately about the child, the young person's experience of the initial health assessment, but also their long-term health outcomes, which hopefully doing a good IHA can impact on into the future.
Vicki, is there anything you'd like to finish with?
I think it's probably the theme that's gone through all of this, and it certainly was the theme of the whole project in wanting this to lead to better health outcomes. So if the standards themselves can ensure that every child and young person has a comprehensive, consistent appointment and evaluation, regardless of where that is or by whom, and the assessment then becomes equitable wherever those children are, and then it needs to lead to those improved health outcomes.
Thank you very much, both of you.
Thank you.